We're continuing our serious illness talk, and one of the tips that we have, or concerns that we have in our serious illness discussion, is ask your doctor some difficult questions. AARP had recently in one of their articles that silence can be deadly to your health. You need to ask some hard questions, and you need to be able to let your physician tell you some difficult news. They don't want to lie to you. And certainly it's easy for them to say, oh, everything looks great, but sometimes things don't look great. You're in great condition for the condition you're in. Maybe that's what they're actually telling you.
And even if the physician tells you things that you don't want to hear, sometimes you need to hear them to better understand your disease process, and then it will help you plan your final weeks, months, years of life.
Try to take somebody with you. 4 ears listening are better than 2.
Yeah.
If you want to record it, ask them, hey, can I record this, or can I, FaceTime my loved one in on this? I need them to be able to listen also. So get the information that you need, even if it's not necessarily what you want to hear. Now, I have had patients tell me before, don't tell me, I don't want to know. The patient actually told me, she said, my family is out in the waiting room and I'll either wait here and you go out there, or I'll go out there and you bring all of them in here. She said, whatever you tell me, it's just going to make me worry and I don't want to know. I have told them what I want and how I want to live, but I don't want to hear it. And I want them to make the decision and then just let things play out to give me the best quality of life. So sometimes patients don't want to hear. I had a patient just this last week that he wanted to come back to our community living center. And I told him, your health is in a situation right now that, I can let you come back, but there are some things I need direction on. I need instructions before you come back. He was in crisis and he's stable, but he is right at the edge of being stable. And I told him I've got to have some answers. And he pointed over there and he said, ask her. He wanted his daughter to make all those decisions. And so I said, your daughter? And he said, yes, ask her out there.
Yeah. And, medicine has changed. It used to be very one-sided, paternalistic in nature. It's very collaborative. So it's very important for us to have patients or family members, whoever they designate, have an equal responsibility to their care. As physicians, we can tell you what things that you shouldn't be doing for whatever your health, illness is. And you have a choice to either listen to help you live, provide a longer life, or you can just say the heck with you and we're going to continue doing whatever we want to do, but know that there's consequences for your actions, and you should be equally involved in your care just as a physician was.
And I agree with what Dr. T says on that we as the physicians and experts are not to tell you what to do, and we are not to judge you for your behaviors and the decisions that you make. I ask that you please be honest with us. Please tell us if you are following, are not following, if you're drinking, if you're smoking, if you're doing something you know we don't want you to do. Please tell me. I'm not taking that medicine because it makes me feel bad. Just tell me, because I want to be able to take care of you in a manner that you want to be cared for in. It's not mine to judge you, and it's not mine to make decisions for you. Now, that being said, there are definitely some difficult questions that you can ask us to put us on the spot if you're ready to hear some answers that are truthful. And just tell the physician, I'm going to ask you some hard questions and I want you to be honest with me.
Right. And I think we kind of went through and listed some of the tough questions we've been asked, but you can always drop in the chat other questions that you've maybe proposed to your healthcare team. But I think it's really important to ask the questions just so you have better understanding of your illness and also have a better relationship with your physician. Once you're able to ask open-ended questions to them, then you develop a stronger relationship, because it really is a relationship, a collaborative relationship that will make your health beneficial and your care beneficial.
If you don't understand, please tell them. I need you to explain that better. Can you explain that better for me? I mean, they are very well trained, highly educated, but they should be able to put it in terms that you understand without making you feel bad. They went to special training to be able to know those terms, and they don't have to use them to explain it to you. They don't have to drown you in numbers or in imaging results. They should be able to communicate with you in a manner that you can understand. So tell them, I need you to explain that to me better. Can you make that in a language that I can understand? I come from, I sell phones at Verizon, or, I was a school teacher, and I need you to talk about that in terms that I understand.
Yeah, and a lot of times my coworkers, they like my dummy down version of events, but the way we learned that medical language in medical school, and we had to learn it. It wasn't our everyday language. So I always can work with my patients to try to explain it into a level of understanding. Sometimes I might draw pictures to make my point across, or just less words. I mean, it just depends. I meet patients where they're at. If they're hearing impaired and they want to read, I'll write things down, or vice versa. If they can't hear really well, you have to use hand language and try to communicate with them.
Right. And sometimes I've got patients that maybe don't speak English, and we have a translator service that we need to call. We're not supposed to use family members or friends, and if we don't have an excellent command of that language, we're not supposed to be the ones doing that. We actually have a translator service so that we can communicate with them. And if the patient has hearing impairment, then we need someone that can come in and communicate by sign language.
Exactly. So some tough questions I've been asked is, top on my list is, when you go into a room as a palliative physician, people know palliative does not, there's usually not a cure related to their disease. So they'll ask a loaded question of, how much time do I have left, doctor?
And I think sometimes they actually think we're going to give them a time or a date and tell them.
Just pull it out of our box.
Yeah. And then sometimes I know that they're not expecting that from us, but they want to have some reference as to, are we talking days? Are we talking weeks? Are we talking months? Do I have less than a year, less than 5 years? So sometimes they understand that we can't give them an exact date or time, but we can give them a range. And that's usually what we do, is talk in probabilities and talk in a range of times.
Yeah, and as hospice and palliative medicine providers, we have great prognostication tools related to illnesses. But again, we are not the higher power, whatever power you believe in, whether it's God or, you pray to Snow White, whatever it is, whatever that is, we don't have control, because sometimes we're shocked when patients pass quickly because their disease may have taken a turn and we don't have testing to know that was happening or evolving.
And I think physicians kind of have two basic reasons why they don't like to tell a time. One is they're afraid that they're going to be right. And they'll say, I think you have so much time left, whether it's a week or a month or a year, and then the patient will quit. They will feel discouraged and they'll stop. And the human will is so unbelievably powerful that they can will themselves to outlive what nature says a person can. Now, they are mortal and time will catch up with them, but I've seen patients do incredible things when they have a goal or a date that they want to get to. So physicians are afraid to tell because they don't want to discourage you, and physicians are afraid to tell because they don't want you to be mad at them if they're wrong. We want to be wrong. We want you to continue to live. Why we're telling you that we think your life expectancy is short is we're telling you because we think your time is limited, and it's not fair for us to know that and not share that with you, because we want you to be able to get your affairs in order. If there's somebody that you need to see or talk to, if there's somebody you want to make amends with, if there's somebody you want to tell off, now is the time. And so that's our responsibility. So physicians really need to be less fearful to tell you that, even though it's bad news, because I've had people tell me to get out of the room, they don't like what I have to say. But I feel like I did my responsibility as best I could, and I certainly want to ease the blow, but I do feel like it's my responsibility to tell them that.
Yeah. And I've had it go both ways. I've had it where I've told people that they have less amount of time, and they're like, well, we're going to show you, lady. And they live a long time, and that's wonderful. And then I have had it where, you tell them, and sometimes that's all they're waiting for to let go.
Is to hear that.
So, and they just want to hear it. And sometimes it's not even for them to hear it. They kind of already know it, right? It's more for the loved ones to hear it. And then when the loved ones express an acceptance, that's when I see them let go of living.
So the amount of time left is a common question that we get, and it's not one that we can just give an answer. It's a conversation.
Yeah. Another big question we always hear is, oh, so there's nothing more you can do?
Oh, that infuriates me. There are a lot of things I can do. I can't do what you want me to do. I can't give you cure. I can't, if your circulation is bad and they had to remove your leg, I can't make that leg come back. If your diabetes has damaged your kidneys and you're on hemodialysis, I can't make your kidneys work again. So there are many things that I cannot do, and that is correct, but there are lots of things that I can still do. But you may not like the things that I have to offer because they're not curative. They're treatments. They're care related. They have to do with compassion. They have to do with easing burden. They have to do with making you comfortable and making the best of every day that you have left. But I can't cure you. And so there are things I can do, but not what you want.
Yeah, and it's so important to remember, like, when you are early on in your disease process, listen to what the experts say that could help you. Because sometimes, like Dr. Bohn said, if you've already had an amputation, you're too far in that disease process that we can really make a difference. And that can affect your patient relationship with your physician because you think we're not doing enough. Oh, they don't care about me, and there's nothing you're going to provide for me. And they'll throw it at us. But again, it's about the collaboration of your disease with your medical team, and make sure you pick a good one so you can learn how to live with your chronic illness as long as possible. I'm also throwing a question of, what would you do, doctor?
Oh, I think that's a good question. That's a worthy question.
Yeah, and people will ask, like, what would you do? And
if this was you, if this was your spouse,
if this was your mom, this was your child, what would you do? And it's a loaded question, right? But it's a very important question because it really allows me to be perspective. What would I do in this situation? Sometimes we have great ideas of what we think we're going to do, and then until you're faced with it, you don't know.
And that's how I answer it a lot of times too, is I'll tell them I've never walked this path, where it's affecting me personally. I have had, family members, certainly, my mom and my dad passed away. My dad was in his mid-50s. I don't think anybody should die in their mid-50s. And so I know how he felt. I know what he wanted. I know what was important to him, but I've not walked that path. Now, I don't want to be a burden to my family, to my kids. I've explained that to them. But as far as being able to specifically tell a patient how would I respond, I always have to preface it, well, I've not walked that specific path that you are. So, whatever I say, you have to take that with a grain of salt because, one, I'm not you. We've had different life experiences and we've been through different trials and tribulations in our life. Some patients have been through, various things that have really challenged them throughout their life. And it's made them stronger people. And I know physicians, particularly the last few years, 2020 has brought on, a view of end of life in the hospital that a lot of physicians are not fond of.
No. And I just think it's important for us to always preface it with, of our experience, but also know that they can make their own decision. And again, back to what Dr. Bohn said at the beginning of the thing, it's good for us as the experts to not judge their decision making.
Right. We want to support you and we want to care for you the way you want to be cared for. So you've got to give us guidance. And I often tell patients and families, you don't have to name every specific occurrence, because you can't even guess the infinite possibilities of an outcome. However, you can give your family guidance and information as to how you want to be able to live your life and what quality really means to you. So if a patient asks me that question of what would you do, I try to go back to that one. I can't say I've not walked your path, but I can tell you, if you really want to press me, what quality of life means to me, and what I think outcomes for you might look like, and if I personally would find that for me acceptable. What I find happens to a lot of patients is when they were young and vigorous, they didn't realize how life would change over time. And so they may have lost a skill, and they may have lost an ability, and they had to, start taking more medications. And then as time went by, what was once quality of life has now withered to a different point. And so they may find something acceptable for them that for me personally would not be acceptable, because I'm still very functional. And so it's all beauty in the eye of the beholder.
Exactly. Another question that we often get is am I cured? Is there a cure? And that's another loaded question.
If it's a bladder infection, a lot of times I can cure that. Strep throat, we can cure that. A surgeon can cure appendicitis. Pregnancy can be cured.
You deliver a baby. But there are certain diseases, unfortunately, that are chronic illnesses that are never cured. They may stabilize.
Whether it's diabetes or hypertension, those don't cure with a pill. You have to keep taking the medication.
Yeah, you have to keep making the dietary changes that you need and take the medication and try to do the best that you can for, lung disease, use your inhalers, try to lessen the damage to your lungs by following your drug regime, which I know can be cumbersome.
So cure is kind of a relative thing that's limited to a certain number of diseases and disease processes. Most things, many other things, are chronic illnesses. Now, for a patient that maybe needs a transplant, that you might think, oh, well, they needed a lung transplant or a liver transplant. That's been cured now. True, that problem has, but now because of the transplant, there are various other things that have occurred and medications that they may need to take to keep them from rejecting that new organ.
Yeah. And a lot of times patients will hold on to that. Well, if they would have just found this sooner, they could get a transplant. And transplants are not easy.
No.
Like Dr. Bohn says, they're very, very involved.
And your body knows that it's not native. It didn't come from me. And so a lot of times special medications need to be administered to keep your body from rejecting that. And
those medications create more problems within your system.
And the rejection could make you sick, or the rejection could just mean that the organ doesn't work anymore. And then you're back to where you were with a dysfunctional organ in your body, and now this dysfunctional organ isn't even yours.
Right. It's really important for you to ask questions about side effects. Physicians, clinicians, healthcare providers, they'll blurt out things that we could do. But what are the side effects? Like, what is that going to look like? Because it might not be something suitable for you. I may tolerate more side effects, because I'm a healthier person. Dr. Bohn might tolerate things differently. We're all individuals, right?
If the side effect was hair loss, she could tolerate more side effect of hair loss than I could, because I don't have that many hairs, but she has a lot. So depending on what the side effect is, it may be something that you don't think is that worrisome. But yeah, ask your doctor, what are the side effects?
It's also important to ask, what are the outcomes? Like, if you're going to have surgery, like what does that look like? Because oftentimes you'll have a senior go in that has a lot of comorbidities, and they'll fracture a hip or whatever, and this, we're just going to go in and do surgery. But what is that outcome of a surgery? What was the patient like before? What are they now? I can tell you my outcome of surgery will be far different than my husband's, Dr. Bohn's. I'm kind of a wimp. She's a strong Midwesterner. I think I would be more of the princess type in the hospital. wanting everything given to me. I'm from New Jersey. I did not grow up in a farm trying to live off my land like Dr. Bohn did. So there's everybody, you need to look at the whole picture of what are the outcomes and how is it going to affect you to know if that's something you even want to take on.
So I know that if like a circulation surgery, what if the outcome of that circulation surgery is that the circulation actually gets worse and you end up needing an amputation? What if the surgery is a cardiac procedure and during the surgery you end up having a stroke? There are risks associated with surgeries and with interventions. I've got a friend and the husband is going to get a carotid surgery done. What if he has a stroke during that surgery? I mean, that's a worrisome thing. So outcomes are very important.
Exactly.
So in closing, Dr. T and myself want to thank you for your attention today. And if we missed an important question,
please tell us. We'd like to know.
Put it in the comments.
And just know that you are in charge of your healthcare.
Yeah, we want to have collaborative relationships with patients, and patients need to take control of their health. Physicians need to take back control of healthcare. It's become big business, and physicians have lost control of that. We are swirling in the sea of electronic medical records and, the onus of exams and trying to, manage and balance all these things. And somewhere the patient-physician relationship has gotten lost. So patients, take control back of your health and help us take control of healthcare.
Yes. Thank you so much for joining us. We look forward to seeing you next time.
Bye now.
Bye-bye.